Hey everyone, I'm Dan Dean. I got a question for you. Not one of the three, but how's your nose doing these days? I'm not asking you how it looks. I'm talking about how you're breathing. If you're having a little bit of a hard time breathing through it, then this episode of Three Big Questions at Rush is tailor-made for you. We are going to be talking to Dr. Michael Egerstadt about how you can improve your nose's breathing and function. Dr. Egerstadt is a facial plastic and reconstructive surgeon at Rush who has helped hundreds of patients with this very challenge. Welcome, Dr. Egerstadt.
Thanks. Great to be here.
Okay, so I gotta be honest with you here. Like, maybe my nose breathing or someone else's nose breathing isn't great, but what's the big deal about that if it's not 100%?
Yeah, that's a good question. That's a question that I sometimes am posing to patients. I say, what is it that you're hoping to get out of this? And so if your nasal breathing isn't great, it can affect a few things, right? Some patients come in and say, my sleep is affected by it. That's a common one for patients. They'll walk around during the day and be able to breathe okay through their nose. They lie down to go to sleep and they can't. That's really troubling for people. Some patients say my exercise capacity is not there. They can, at rest, they can breathe well through their nose, but as soon as they really try to, pull a lot of air through their nose, they're getting on the treadmill, it's not enough. And it feels like they're very short of breath. And then some people come in because they have snoring, sleep apnea, and these kinds of issues too. That affects your life, right? If you're not getting quality sleep, you're not able to exercise, that's going to affect your life. And that's a moment when you're going to kind of want to come in to see us and see what's going on.
So how do I know who the right person to see and when the right time to come in would be? Because I don't think I would know.
Yeah, good question. The right time, very different for every patient. Some patients, have slightly restricted breathing in their nose and it really just drives them up a wall. Some patients are able to ignore anything in their life and want to stay far away from a doctor's office, which I totally understand. But they can't move air through their nose at all. And they say, finally, this is the time. There's no really good answer because you're not going to have sort of something, switch in your life that's going to give you the warning sign that you should come see us. So the right time is whenever it's right for that specific patient because it's bothering them enough. Now, who to see? That's actually a really good question because different surgeons can be a different approach towards nasal breathing, and the right person can be hard to know. So if you have a history of trauma to your nose, you've broken your nose before, if you have any cosmetic concerns about your nose in addition to your nasal breathing concerns, then a facial plastic surgeon like me is the right person to come see. We can help you out with changing the appearance of the nose as well. We're well-versed in trauma. We're the facial trauma surgeons at Rush and at other hospitals, so we'd be the right person for you. If you're a person who has a strong history of sinus issues, sinus infections, really bad allergies, things like that, then one of my colleagues in rhinology may be the better person to see. Rhinologists are ENTs who have a special training in sinus disease and allergy as well. So either way, we get you to the right person. It really doesn't matter, at least at Rush, who you come see because we plug you in based on what you've got going on with the right person. But if you want to skip a step, follow those loose guidelines and get you to the right person right away.
Okay, so say I'm a patient, I'm like, okay, I'm having trouble breathing. I know I want to go to Rush. Okay, what are the things that you or a rhinologist could help me with to improve my nasal breathing and function?
Yeah, my kind of falls into 3, 4, 5 categories of patients, and there's a lot of overlap here. A lot of patients, when they come to see us, will have multiple things going on in the nose and are a little bit surprised when I start listing off the things that I find in their nose. So some patients, you may have heard of a deviated septum. That's very, very common, very difficult for patients to breathe, sometimes out of one side, sometimes out of both sides. Pretty straightforward to fix. I do a lot of surgery to repair deviated septums, and especially some of the more complex ones get sent my way. Some patients have where they, like I said, they lie down to go to sleep and their nose is immediately congested. Or if they get even a little bit sick, their nose is just stopped up completely. Those patients can have what's called turbinate hypertrophy. That's another thing that we address surgically in the nose. Both rhinologists and myself will address that. The thing that falls a little bit more into the facial plastic surgery category would be patients who have nasal valve collapse. So I have that myself. Those are patients where they oftentimes see it when they're really working, meaning they're exercising, things like that. And they try to take a deep breath into their nose, and the nose kind of collapses in and they're unable to get a full breath in. Those patients are typically best served by a facial plastic surgeon like myself, because we perform the majority of nasal valve repair would be the procedure that we perform for that. Those are the typical categories of patients who have nasal obstruction or nasal stenosis. There's a lot of different variation within those categories, and there's a lot of things kind of outside of that can lead to this as well, rarer things. And I mean, we're well versed in taking care of all of that and everything from the really, really common to the really, really rare. So having somebody look in there, they can pretty readily tell you what the best approach for you is.
Thanks so much for joining us today, Dr. Egerstadt. Really appreciate it.
Thanks, Dan. Have a good day.